Hi, everyone. My name is Rachel Goodrich, and I am a student at Salt Lake Community College, and I am doing a research presentation on social work. And my research topic is substance abuse addiction, mothers with substance abuse addictions, women who are addicted to substances, and the effect that it has on their children and substance abuse treatment. Here I have my scholarly articles. I have examination of the influence of cognitive behavior therapy components, consumer satisfaction, and engagement in mothers referred for drug abuse and child neglect on treatment outcomes. I also have the role of mothers' parental substance use disorder and early parenting on child social cognition at school age. So I have my interview questions where I interviewed a social worker in this field. And my interview questions are number one was what qualities are essential for being a social worker in the substance abuse treatment field? And the answer to that from the social worker was some of the most important qualities for being a social worker in treatment of substance use disorder include, but are not limited to, a strong understanding of evidence based practice, which is continually being updated, the ability to be compassionate but firm, empathetic but honest, and kind but holding boundaries. It is also important to understand that substance use is typically a symptom of greater issues such as trauma. It is key to treat the whole person and not just the symptoms. Finally, I believe in order to be successful in treating substance use disorders, a therapist must have a very clear understanding of how substances impact the brain and the body. Substances also impact the whole family system, and this cannot be overlooked. We have question number two. What defines someone with a substance abuse addiction? What makes an addict? And the answer to that was addiction has been called an allergy of the body, obsession of the mind, and malady of the spirit. Anyone can be an addict. There are factors that can contribute to addiction, such as genetic predisposition, environment, and actual physical use of substances. To be diagnosed with a substance use disorder, the use has to cause marked disruption in the person's life. This disruption can be anything, excuse me, this disruption can be anything from increased depression and anxiety, job instability, loss of family or home, financial insecurity, increased mental health issues, and physical health issues, among others. Question number three is what types of treatment tools have shown success when working with mothers dealing with substance abuse addiction? And the answer to that is most evidence based practices are proven to assist all clients in overcoming addiction if the client themselves does the work. Modalities like cognitive behavior therapy, acceptance, and commitment therapy, and dialectical behavior therapy, among others, allow the client to gain coping skills, talk through the underlying issues that contribute to use, and improve their awareness and ability to manage triggers. Beyond that, all underlying mental health issues must be addressed, such as trauma. Trauma modalities that are most effective are eye movement therapies like EMDR or art therapy, narrative therapy, and internal family systems, etc. Therapy in conjunction with medications is a proven method of overcoming addiction and improving overall well being. For many mothers, an unfortunate consequence of addiction is the loss of custody of their children. This is often a strong motivating factor in these cases, but the treatment of mothers with addiction is no different than the treatment of those who are not mothers. The modalities are the same, and it's simply a matter of finding the one that works best for each client as an individual. Question number 4, how does working with addicts support your personal values and beliefs? I have seen a lot of addiction in my life. Working with addicts has been a very fulfilling experience for me. It hasn't always been easy, as working in addiction means you see people, you grow, you grow to care about loss, lose their, sorry, let me start over. It hasn't always been easy, as working in addiction means you see people you grow to care about lose their battle with substances. However, seeing someone overcome their addiction and live a sober, healthy, happy life is the most incredible thing to witness. It's always been a value of mine to help others, and I have found that doing this work is a perfect fit in my value system. Question number 5. What motivated your decision to work with individuals facing addiction? The answer to that was, before I was born, my grandfather died from cirrhosis of the liver from all his years of drinking. I learned of this inadvertently and realized that addiction isn't something that is readily talked about in society. As I got older, I started to see friends and family members start to struggle with addiction. My sister became very addicted to opiates, and it almost killed her multiple times. As I learned more about addiction, I came to the conclusion that I wanted to work with those with substance use disorders because it is 100% treatable. I felt like I could make a difference in the lives of those I serve. Excuse me. Question number 6 was, do you believe that there's sufficient funding to assist addicts in recovery, addicts in receiving the treatment they need? And what are your reasons for your answer? And the answer to that is no. There is a severe lack of funding for substance abuse treatment. Insurances can cover some of the treatment, but many clients are left with massive copays or out-of-pocket expenses. It is also very difficult at times to prove a medical necessity to insurance companies in order to get the whole length of stay covered, even at outpatient levels. After treatment, it becomes even more difficult for those with severe addictions to find housing or sober living, obtain aftercare services, etc. Insurances don't cover sober living homes, and unless a client can gain employment immediately, which many can't, they are often unable to find immediate housing. Because of this, it becomes all too easy for clients to return to old stomping grounds with old acquaintances, eventually leading to relapse. And the final question is number 7, what advice would you give to someone starting a social work career? Excuse me. So the answer to that was, make sure that social work is what you absolutely want to do. Social work is a field that can be extremely rewarding, but can also be quite challenging at times. You are in a position to hear the worst experiences a human can have. You have to make sure you understand and can practice healthy self-care, hold firm boundaries, and do your own work so you can show up for your clients. It is important that you know your own limitations and that you have a strong understanding of what you can and can't handle. For example, there will be certain populations that you will not be okay to work with. This could be working with perpetrators or those with severe mental illnesses such as DID, victims of severe or complex trauma, etc. So while pursuing your career, make sure you learn all that you can about as many populations so you can gauge your own biases. It is a common mistake that social workers believe they can work with any population without leaving, excuse me, without leaving room for their own humanness. This leads to severe and rapid burnout. Again, I can't stress enough the importance of having your own therapist or doing your own work throughout the duration of your career. So the social worker that I interviewed, she works for Steps Recovery at Annie's house. This treatment center is located in Draper, Utah. So I wrote here, Annie's house is an inpatient substance abuse treatment center situated in Draper, Utah, exclusively designed to support women in need of comprehensive care for substance use disorders. They offer a 12-step program as well as a wide array of evidence-based therapies, including CBT, DBT, individual therapy, group therapy, family therapy, holistic therapy, and trauma therapy. Their services are tailored to women aged 18 and above. To be admitted, you will need to complete a detox process before proceeding to the next steps. Following insurance approval, you can benefit from their inpatient services for a period ranging from 30 to 90 days. After the initial phase, you can transition to their sober living house and participate in their intensive outpatient program, or IOP. They accept most insurance plans, but not Medicaid. Annie's House and Steps Recovery as a whole's mission statement is, our mission is helping those who may be clinging to the last bit of hope, or even lost all hope, regain a life in which they can find true joy and happiness. Our culture is centered on helping each of our clients and family members remember and realize that there is always hope. And some of the social workers' responsibilities at Annie's house. The social workers at Annie's house play a crucial role in providing personalized support to their clients. Their responsibilities include regular one-on-one meetings with clients to assess their needs. Additionally, they ensure that clients attend appointments, accompany them to court as needed, and provide feedback to the judge on their progress. The social workers also maintain contact with probation officers and make necessary arrangements with child welfare services for clients with children. Furthermore, they assist clients in developing post-treatment plans, finding suitable housing, and screening employment opportunities. When clients are ready to transition to a sober living home, the social workers ensure that they have the necessary support. Additionally, the social workers actively participate in clinical team meetings where they provide insightful reports on their clients' progress. Views of ethical behaviors for Annie's house. So at Annie's house, social workers are committed to maintaining professional boundaries with their clients. If a client attempts to form a close personal relationship, the social worker must establish the appropriate boundaries. While offering support, these boundaries are set in place to protect both the social workers and the clients. It's important to note that social workers are prohibited from having pictures of clients as well as their contact information, including phone numbers, emails, and social media accounts. The starting salary for this position is $44,000 a year, and social workers are salaried employees here. Additionally, Steps Recovery, or Annie's House, values internal growth, often promoting its employees before opening job opportunities to external candidates. The overall job satisfaction is fair. This is part of the field of social work, as it entails providing human services and facilitating access to resources for those in need. In conclusion, Annie's House serves as a valuable resource for women dealing with substance use addiction. The exclusive focus on women creates a safe, nurturing environment, encouraging open communication and healing. Then in closing, working in the substance abuse recovery field is incredibly challenging yet profoundly rewarding. Witnessing the devastating impact of drug and alcohol addiction on individuals and their families is truly heart-wrenching. However, it is equally inspiring to see individuals overcome their addictions, reclaiming their lives, and rebuilding broken relationships. Thanks for letting me share this for you and with you. And that is all that I have. Thanks again.